How does Medicare work if I also have COBRA? Imagine you're juggling two health coverage options at once. You might wonder which one pays first or how long each lasts. That's what we're here to clarify. When you have both Medicare and COBRA, how they work together depends on your situation and timing. Let's break it down step by step. First, Medicare is the federal health insurance program for people aged 65 and older, or for certain younger people with disabilities or end-stage renal disease. COBRA is a law that allows you to keep your employer's health plan for a limited time after leaving your job or losing coverage. If you become eligible for Medicare first and then lose your job, Medicare will usually be your primary insurance. COBRA then acts as secondary coverage, meaning it might cover some costs Medicare doesn't, like co-payments or co-insurance. But keep in mind, COBRA coverage generally ends when you enroll in Medicare. On the flip side, if you have COBRA first and then become eligible for Medicare, you will typically need to enroll in Medicare. Once you do, COBRA coverage usually stops. However, your spouse and dependents can often keep their COBRA for up to 36 months, as long as they aren't eligible for Medicare. Now, for those working past 65, the rules can get a little more detailed. If your employer has fewer than 20 employees, Medicare is usually the primary payer, and your employer plan or COBRA is secondary. But if your employer has 20 or more employees, your employer's plan or COBRA is primary until you stop working or lose coverage. If you become eligible for both Medicare and COBRA at the same time, it's usually best to go with Medicare as your main coverage. It often offers better benefits and lower costs. You might choose to keep COBRA for family members who aren't eligible for Medicare, but for yourself, Medicare is generally the smarter choice. To be sure about how your coverage will work, contact your COBRA plan administrator. Ask how benefits will coordinate and which plan pays first. Remember, COBRA coverage is temporary, usually 18 months, but it can extend to 36 months for spouses and dependents in some cases. Cost is another factor. COBRA can be more expensive because you pay the full premium plus administrative fees. Medicare costs include premiums, deductibles, and co-insurance, which are often lower than COBRA. If you have both, your out-of-pocket expenses might add up, so it's wise to compare your options carefully. In summary, if you have both, Medicare generally pays first. If you switch from COBRA to Medicare, COBRA coverage usually ends. Dependents can keep COBRA longer if they're not Medicare eligible. And if you have end-stage renal disease, special rules might apply during the first 30 months of Medicare eligibility. Always check with your COBRA plan administrator and Medicare to confirm how your benefits will coordinate. This way, you can make the best choice for your health and your wallet.